has taken a microscopic coronavirus to convince us all that we are one community, that we're vulnerable, and that solutions can leave no one behind. Now, all this seems like common sense, but it's rarely put into practice. Now, if every child needs a decent education and we know how to teach him, then why are so many children left behind from this seemingly exclusive club? If every child needs a decent education and we know how to teach him, then why are so many children left out of this seemingly exclusive club? If everyone needs to recover from an illness and we know how to treat them, then why do so many continue to suffer? We have the answers, but somehow the way we build the solutions around them excludes many from reaching them. And that is why over 2 billion people continue to remain blind or visually impaired, although half of this is either preventable or treatable, meaning that we already have solutions for these conditions. The ubiquitous cataract surgery or the even more commonplace spectacles can restore vision, and yet millions of our brothers and sisters continue to suffer needlessly from these treatable conditions. Let me also tell you of a little girl in sub-Saharan Africa who is blind in both eyes because of cataract. A timely surgery could have restored her sight, but eye care hasn't reached her village. But if you look around, you'll see Coca-Cola has. Maybe we should take a leaf out of the textbook of commercial organizations that design for maximum reach. They strive to make their products reach far and wide. They try to ensure that their solutions are designed to reach a maximum number of people. What can we learn from them? Now let me tell you of one ophthalmologist, Dr. Venkateswamy, who set out on an ambitious but a simple quest to eliminate needless blindness. He realized that while doctors had the treatment for a majority of eye conditions, it was not made available where it was needed, and only those who could travel and those who could afford the cost of the treatment really benefited from it. Dr. Venkateswamy, who was commonly called as Dr. V, realized that for any solution to be truly effective, it had to be designed to reach every man and woman, whether they could pay for it or not, whether they were in the villages or in the cities, and even whether they were seeking care or not. He pioneered the concept of eye camps, which would take eye care into the villages. He strived to do this throughout his career as the chief eye doctor of a government hospital. But it was only after his retirement at the age of 58 when he set up Aravind Eye Hospital as a small non-profit 11-bedded eye hospital in Madurai in the south of India. Here he continued the practice of organizing rural eye camps where the teams would go out into the villages to screen patients and offer free surgery for whoever required it. Now this seems like the right solution, but he still found that many patients were not willing to take up this surgery. A study conducted at Aravind revealed that although the surgery was free, patients could not afford the cost of the bus ride, the food, and it also meant that somebody from the family had to accompany the patient to the hospital. This was additional expense, besides the lost wages for a few days. Aravind's eye camps are now designed not only to screen the patients in the villages, but to transport them to and back from the hospital, provide surgery, accommodation, food and medicines, all free of cost to the patient. After 4 decades, now Aravind still organizes 2,000 such camps all over the state of Tamil Nadu, and over 90,000 free surgeries are done through this outreach program. But let us step back and see if this is a holistic solution. Usually these camps are conducted once or twice a year in a given village. Now say you could not make it to the camp, or say you developed eye pain 1 week after the camp was conducted. Now this camp is really not solving your eye problem. So the team at Aravind learned about this shortcoming when they did a study in '96. They found that less than 7% of those who needed eye care actually came to these camps. So while these camps were helping thousands of people, it was still not a complete solution. So they went back to the drawing board to find a solution that would be small enough to work in the villages, ensure high quality of care, but also be affordable for Aravind to provide it. And that is how the Aravind Vision Center model was developed. These are rural clinics run by ophthalmic assistants. These are rural clinics run by ophthalmic assistants where patients pay 20 rupees for a complete eye examination, which includes a teleconsultation with an eye doctor who sits in one of Aravind's base hospitals. Close to 4 lakh rural patients are seen every year through these vision centers. But the best part is only 1 in 10 need to travel to a base hospital for higher levels of care, say for surgery or to see a specialist. For all the rest, their complete eye care needs can be satisfied at the vision center itself. They can even purchase a pair of spectacles in a frame of their choice. So our solutions need to ensure that people are able to access them with dignity. Today, the Aravind network handles over 4.5 million patient visits and performs over 500,000 surgeries and procedures every year. Over half of this is provided completely free of cost or at steeply subsidized prices for the patient. And yet, Aravind is able to be a self-sustainable organization and also generate a healthy surplus that has fueled its growth and expansion across the state. This is because Aravind's high quality of care is able to attract a significant number of patients who are willing to pay for its services. Now, medicine is an expensive affair. So how can we make it affordable without compromising quality? And this is a riddle that healthcare providers face the world over. Aravind, by leveraging economies of scale and taking several cost-effective measures, has been able to keep the costs down. These measures have also helped in another very important way. Waste generated by healthcare institutions are among the leading contributors of the global carbon footprint. Through responsible reuse of material, Aravind's carbon footprint is just a fraction of hospitals in the West. Aravind's waste from 100 cataract surgeries is similar to the waste generated by 1 cataract surgery performed in the United States. But Aravind is able to deliver this with high levels of safety. Aravind's infection rates are significantly less than what is reported in the West. Now, all this seems like a good solution to the problem, but Aravind operates only in and around Tamil Nadu in India. How can it solve a global problem? And that is why Dr. V open sourced the Aravind model. In fact, he started a unit called LICO to share this model with other eye hospitals across the developing world. The Aravind model of high quality, sustainable care has been successfully replicated across India and several developing countries. Aravind continues to innovate and experiment to find better solutions for this problem of blindness and visual impairment. Together with its partners, Aravind is trying to address this global problem through compassion, perseverance, and creativity. Thank you.